When you or a loved one hears the word cancer, one of the first things you'll learn about is its stage. This can be confusing, but understanding it is crucial for knowing what comes next. In this video, we're going to explain every stage of cancer in a simple, clear way. We'll break down what stage 0 through stage 4 really means for the body and the path forward. Our goal is to give you the clear, straightforward information you need to feel more in control during a difficult time. Let's begin. Let's start with what is called stage 0 cancer. This might sound a little strange because we often think of stages starting at 1, but stage 0 is a very real and important first step to understand. Stage 0 is also known as carcinoma in situ, which is a Latin term that means in its original place. This name is very descriptive because that is exactly what stage 0 cancer is. It is a collection of abnormal cells that have been found in one specific spot in your body. These cells are not yet behaving like typical cancer cells because they have not started to move or spread into the surrounding tissue. You can think of it like a seed that has the potential to grow into a weed, but it is still contained within its own little packet. It has not started to sprout and send roots into the garden just yet. The body is a complex system of cells, and sometimes a few cells can change and become abnormal. In stage 0, these abnormal cells are present, but they are playing by their own rules in their own small area. They have not invaded the neighborhood. The main benefit of finding these cells at stage 0 is that it is the earliest possible moment to take action. It gives you and your doctors a chance to address the situation before it becomes more complicated. A practical tip here is to remember that regular checkups and screenings are very valuable. They can help to spot these changes early when they are most manageable. It is a good idea to talk with your doctor about what screenings are right for you. Now let's talk about stage 1 cancer. This is the first stage of what is called invasive cancer. This means the abnormal cells have started to do a little more than just stay in their original spot. In stage 1, a small tumor has formed. A tumor is a lump or a mass of these abnormal cells. The key thing about stage 1 is that this tumor is still quite small and it is localized. That means it has not spread to other parts of your body and it has not moved into the nearby lymph nodes. Lymph nodes are small glands that are part of your immune system, and they are often the first place cancer cells travel to when they start to spread. Imagine your body is like a city. In stage 0, there were some troublemakers in one building. In stage 1, they have organized and taken over that one building, but they have not yet gone out into the streets or to other parts of the city. The abnormal cells have started to grow and form a small contained group. This is a very early stage of cancer. The cells have begun to break through the initial boundary where they started, but they have not traveled far. Finding cancer at stage 1 is very helpful for your health. Because the tumor is small and has not spread, it is often easier to treat. The goal of treatment at this stage is to remove the tumor completely and make sure no abnormal cells are left behind. A helpful thought for this stage is to see it as a clear signal that your body needs some attention. It is a chance to work with your doctors to create a plan that supports your body and helps you get back to good health. It is a time to focus on your well-being and take positive steps forward. Next, we will discuss stage 2 cancer. At this stage, the situation has become a bit more serious, but it is still considered an early stage of cancer. In stage 2, the tumor in your body has grown larger than it was in stage 1. It is still in its original area, but it is more noticeable. In some cases, the cancer cells may have started to spread to the nearby lymph nodes. Remember those small glands that are part of your immune system. They are like the local police stations of your body. If cancer cells are found in the lymph nodes, it means they have started to travel a little bit. Think back to our city metaphor. The group of troublemakers in the building has now become larger and more organized. They might have even sent a few people out to the nearby streets, which are the lymph nodes. However, they have not yet traveled to distant parts of the city. The tumor is growing, and it might be pressing on the tissues around it. The body is sending more signals that something is not right. The benefit of a stage 2 diagnosis is that the cancer is still in a manageable state. It has not spread to distant organs, which is a very important factor in treatment. Doctors have many effective ways to treat stage 2 cancer, and the goal is still to cure the disease. A practical tip for this stage is to make sure you have a strong support system. This can be your family, your friends, or a support group. Talking about your feelings and experiences can be a valuable part of your journey. You are not alone in this, and having people to lean on can make a big difference in how you feel day to day. Now we move on to stage 3 cancer. This stage is often called locally advanced cancer. This means the cancer has grown even larger, and it has started to affect the surrounding tissues more deeply. It has likely spread to several nearby lymph nodes as well. The cancer is more present and active in that one region of your body. Let's go back to our city example. The group in the building has now taken over the entire block. They are in the streets and they have a strong presence in the local area. However, they have not yet set up operations in other cities. In stage 3, the tumor is larger and may have grown into nearby muscles or skin. The cancer cells have traveled through the lymphatic system and have settled in several lymph nodes. This shows that the cancer is becoming more aggressive and is trying to expand its territory. Even though this sounds serious, it is important to know that stage 3 cancer is still treatable. The treatments will be more intensive than in the earlier stages, but there is still a good chance of success. We have now arrived at stage 4 cancer. This is the most advanced stage, and it is also known as metastatic cancer. The word metastatic means that the cancer has spread from its original location to other distant parts of the body. The cancer cells have traveled through the bloodstream or the lymphatic system and have started to form new tumors in other organs. In our city metaphor, the troublemakers have now traveled to other cities and are starting to cause problems there as well. For example, a cancer that started in the lungs may have spread to the liver, bones, or brain. These new tumors are made of the same type of cancer cells as the original tumor. So if lung cancer spreads to the liver, it is still called metastatic lung cancer, not liver cancer. At this stage, the cancer is widespread and it is affecting the whole body. This makes it much more challenging to treat. The focus of treatment for stage 4 cancer is often different from the earlier stages. While a cure may not be possible, the goal is to control the cancer, to slow its growth, and to manage the symptoms. The aim is to give you the best possible quality of life for as long as possible. There are many treatments that can help with this, and new ones are being developed all the time. A comforting thought for this stage is to focus on living each day to the fullest. It is a time to prioritize what is most important to you, whether that is spending time with loved ones, pursuing a hobby, or simply finding moments of peace and joy. Your medical team will be there to support you with managing your health, so you can focus on the things that bring you happiness. So how do doctors find out if you have cancer and what stage it is? This process is called diagnosis. It all starts when you or your doctor notice something unusual. It could be a lump, a persistent cough, unexplained weight loss, or just a feeling that something is not right. Your doctor will start by asking you questions about your health and your family history. Then they will likely do a physical exam. If they suspect it could be cancer, they will order some tests. There are many different types of tests that can be used. Imaging tests like X-rays, kinetic scans, or MRIs create pictures of the inside of your body so doctors can see if there is a tumor. However, the only way to be absolutely sure if you have cancer is with a biopsy. A biopsy is a procedure where a small sample of tissue is removed from the suspicious area. This tissue is then sent to a lab, where a specialist called a pathologist looks at it under a microscope. The pathologist can see if the cells are cancerous, and if they are, what type of cancer it is. Once cancer is diagnosed, the next step is to figure out the stage. A practical tip is to write down your questions before you go to the doctor. It is easy to forget things when you are feeling anxious, so having a list can help you make sure you get all the information you need. When you have a cancer diagnosis, the next step is to talk about treatment. The goal of treatment is to remove or destroy the cancer cells in your body. There are many different types of cancer treatment, and the plan that is right for you will depend on the type of cancer you have, its stage, and your overall health. The most common treatments are surgery, radiation therapy, and chemotherapy. Surgery is when a doctor removes the tumor from your body. This is often used for cancers that are in one place and have not spread. Radiation therapy uses high-energy rays like X-rays to kill cancer cells. It can be directed at the tumor from outside the body, or it can be placed inside the body, close to the cancer cells. Chemotherapy is a treatment that uses powerful drugs to kill cancer cells. These drugs travel throughout the whole body, so they can kill cancer cells that have spread to other areas. There are also newer types of treatment, like targeted therapy and immunotherapy. Targeted therapy uses drugs that are designed to attack specific parts of cancer cells. Immunotherapy is a treatment that helps your own immune system to fight the cancer. It is like giving your body's natural defenses a boost. You may have just one of these treatments, or you may have a combination of them. Your medical team will work with you to create a treatment plan that is tailored to your specific needs. A helpful way to think about treatment is as a partnership between you and your doctors. You are all working together towards the same goal, to support your body and to help you get well. It is important to communicate openly with your team and to let them know how you are feeling, both physically and emotionally. After cancer treatment is finished, a new chapter begins. This is the recovery phase, and it is a time of healing and adjustment. Recovery is different for everyone. Some people may feel a sense of relief and joy, while others may feel a mix of emotions, including worry and uncertainty. It is all a normal part of the process. Your body has been through a lot, and it needs time to heal. You may feel tired for a while, and you may have some lingering side effects from the treatment. This is to be expected. It is important to be patient with yourself and to give your body the rest it needs. Life after cancer is often called survivorship. A cancer survivor is anyone who has been diagnosed with cancer from the moment of diagnosis for the rest of their life. Survivorship is about more than just being free of cancer. It is about learning to live with the changes that cancer has brought to your life. This includes taking care of your physical health, but also your emotional well-being. You will have regular follow-up appointments with your doctor to monitor your health and to make sure the cancer has not come back. This is a good time to talk about any concerns you have. A valuable part of recovery is finding a new sense of normal. This may mean making some changes to your lifestyle, like eating a healthy diet and getting regular exercise. It may also mean finding new sources of support, like joining a survivorship program or connecting with other cancer survivors. Remember that recovery is a journey, not a destination. There will be good days and bad days, but with time, you will find your way forward. What is one thing you learned today that you found surprising or helpful? We would love to hear from you in the comments below. Your experiences and insights can be a source of comfort and support for others. And if you found this video valuable, please consider subscribing to our channel for more content that is designed to inform and empower you on your health journey. Thank you for watching.